Namaste all. So let us continue with the diseases which we are learning. So the next disease which we are going to learn through the Ayurveda perspective is called as Sandhigata Vata. So we had learned Amavata before. So this is related to the joints, but different from Amavata. Let us see what it is. Sandhi Gata Vata. Sandhi is joint. Gata means related to or Vata which has uh, taken Sthana Samshray at the Sandhi. Hence Sandhi Gata Vata. Vata which has taken Sthana Samshray at the Sandhi, at the joint. Hence Sandhi Gata Vata. So joint disorder or osteoarthritis can be related to osteoarthritis. So the disease in which there is pain and swelling in the joints causing restricted or no movement is called as Sandhi Gata Vata. Disease in which there is pain and swelling in the joints causing restricted or no movement. So the movement may be restricted, not like as the normal movement which happens. So the movement is restricted due to pain or no movement due to serious condition of uh, the disease. Okay, so swelling and pain is seen causing restricted or no movement in the joint. Sandhi Gata Vata. It can affect any joint, but usually starts with bigger joints. We know osteoarthritis. Uh, you must have seen or heard about osteoarthritis before. Usually starts with the bigger joints, and usually the joint which initially is involved is the knee joint. Next is the hip joint, then the shoulder joint, elbow joint, the ankle joint, bigger joints. Starts usually with the knee joints because that is one joint which gets strained the most while you do any kind of activity during the day. So be it walking, running, standing. So the knee joint will bear the maximum pressure, weight, wear and tear, strain during any kind of movement. Okay, so usually it starts with bigger joints, but it can happen to any joint, be it smaller or bigger, irrespective of the size, I mean. So Sandhigata Vata is of two types, Dhatu Kshayajanya and Srotorodhajanya. Dhatu Kshayajanya and Srotorodhajanya. So the pathogenesis for both of them is a bit different. Let us see what it is. Dhatu Kshayajanya means uh, the one which happens due to kshaya of the dhatus, depletion of the dhatus. That is Dhatu Kshayajanya. And Srotorodhajanya means the one which happens due to Srotorod or clogging of the channels is Srotorodhajanya. So what are the causative factors for Dhatu Kshayajanya Sandhigata Vata? um, just to mention, you may not come across this, but Sandhivata is uh, something which is said by laymen. Lay people use it, uh, use the terminology Sandhivata. What is your problem? I have Sandhivata. They tell you the diagnosis itself. So, uh, if you read the classical textbooks, you will find Sandhi Gata Vata as the proper title or name of this disease. Sandhivata is uh, used by lay people. So Hetu, what are the Hetus? Dhatukshayajanya for Dhatukshayajanya, Ruksha, Shita, Alpa, Tikta, Katu, kashaya rasa ahara. All these will lead to aggravation of the vata dosha. You can understand. Ruksha, Shita, Alpa, Tikta, Katu, Kashaya, Ahara. Nothing to explain in this. Excessive indulgence in sex. Excessive physical activity, one. And second, excessive indulgence in sex also will take uh, the Shukra Dhatu out of the body. So there will be depletion of the Shukra Dhatu in due to excessive indulgence in sex. Late night sleep, aggravation of vata. Late night sleep. Panchakarma ati yoga, excessive uh, shodhana or cleansing of the doshas more than expected, more than what is expected. So that is panchakarma ati yoga. Excessive physical exertion and exercise more than the capacity, one. And second, also uh, excessive activity, which leads to aggravation of vata. Dhatu Kshaya due to any other disease. So, if there is Dhatu Kshaya due to any other disease, which in which you see Dhatu Kshaya, then it can lead to Sandhi Gata Vata also. So, in that disease, if suppose there is Kavaigunya at the joint, then the aggravated Vata will go and take Sthana Samshraya at the joint and will create Dhatu Kshaya Janya Sandhigata Vata. Holding of natural urges. Veg Vidaran, we already know about it. Fasting, that is Langhana. Excessive Langhana will cause aggravation of Vata. Trauma to the joint. So, any external trauma, accident, or uh, fractures will can cause Dhatu Kshaya Janya Vata, Sandhigata Vata. Now, here trauma to the joint will create Kavaigunya at the joint, at that particular joint. And simultaneously, if there is aggravated Vata, then it will take Sthana Samshraya at that particular joint and will create Sandhigata Vata. So, trauma will not lead to Dhatukshay, it will lead to Kavaigunya. And if there is aggravated Vata simultaneously due to Hetu 7, then that aggravated Vata will take Sthana Samshraya at the trauma place or at the joint which is affected due to the trauma. Okay, so that was about the Dhatukshaya Janya. So in that, most of the, in fact, all of the hetus which we saw were Vata aggravating or Kavaigunya creating. So now let us see the causative factors, etiological factors for Srotorodh Janya Sandhigata Vata. स्निग्ध शीत madhura amla lavana rasa ahara. So here we see kapha and pitta aggravating uh, ahara. So majorly kapha aggravating because kapha will can lead to next is ama and shrotorod. Hence snigdha shita madhura amla lavana rasa ahara which will aggravate kapha and also increase the secretions in the body. Excessive intake food, so quantity of food is more than the capacity of the digestive fire. So in that case, what can happen? Undigested food can remain. I mean, food can remain. Excess food can will remain undigested uh, and can remain undigested for a long time. So one is it will be undigested, and if it is not uh, treated properly or if fasting etc is not done, then it will stay in the body for a longer time. So that can create formation of ama in the body. Daytime sleep will aggravate the it will help in fact to or it will lead to the srotorod, clogging of the pores. Sorry. Panchakarma ayoga. So if there is a yoga, we saw ati yoga. Ati yoga means more cleansing than expected. Ayog means the cleansing does not happen. The aggravated dosha remain in the body, especially vamana. So the proper cleansing does not happen, and the excess dosha stay in the body. So excess dosha staying in the body, when it is kapha, then it will not stay in one place. It will move in different parts of the body and will create srotorod or clogging of the channels. Exercise with indigestion. So the person has indigestion. Okay, ajirna is there. Agrimandya is there. Majorly ajirna. So when there is ajirna, there will be presence of ama in the body. So when there is ama and also excessive exercise, so that ama will travel from, I mean, in various parts of the body. Now, when it is traveling and there is excessive exercise, then Kavaigunya at the joints will be formed. So when there is Kavaigunya at the joints, then ama, while it is moving in the body, will find a good place to stay. It will be the joints, and it will have sthana samshray there and will cause sandhigata vata. Srotorodajanya sandhigata vata. Ama formation due to any other disease. So we know that Agni Mandya is there in most of the diseases. Ama formation will be a resultant of Agni Mandya, and if there is Agni Ama formation, then that Ama, if finds sthana samshray at the joints, will create sandhigata vata srotorojanya. Holding of natural urges, we all know adhyashana, viruddhashana, both these things will lead to indigestion first, then formation of ama. Okay, so here the causative factors will essentially lead to formation of ama, clogging of pores, and will find Kavaigunya suitable or favorable place for them to stay will be the joints. Okay, so that will be the process of disease formation there. The hetus there, we'll see the process of disease formation now. So here dhatukshay janya sandhigata vata. How does the samprapti or pathogenesis happen? Hetu sevan will lead to vata prakop, ruksha guna sevan. So we saw in the hetus that most of the uh, hetus are vata aggravating, and here more is the ruksha guna, because of which vata prakopa will happen severe dryness in the srota. So ruksha guna will create severe dryness in the srotas. The srotas gets filled with vata. Srotas gets filled with vata, and that vata finds a good favorable place to stay in the sandhi, which will lead to sandhi gatavata, which will be dhatu kshaya janya. Now here what happens is dhatu kshaya is there, vata is aggravated simultaneously. There will be exercise or trauma or kavaigunya at the joint, and that vata will find a good place to stay, will be the joint, and will create this disease called as sandhigata vata, which will be dhatu kshaya janya. Okay, so here more of kshaya, vata aggravation, kshaya of dhatus and vata aggravation. These two things are seen. Joint Kho at the joint is common in both the places, even in Srotorod, even in Dhatukshajan. Okay. In this case, it is Vata Prakopa and Ruksha dryness. Rukshata is more, dryness is more, and that aggravated Vata will go and take Sthana Samshraya at the joint, which will create Dhatu Kshayajanya Sandhigata Vata. Now, in the other case of Srotorojanya, Hetu 7 happens. In that Hetu 7, what it will lead to? Kapha Prakopa and or Ama formation due to Shita Guna Sevan. Shita Guna Sevan. The other one was Ruksha Guna Sevan. This is Shita Guna Sevan. Srotorod clogging of channels will happen due to Kapha Prakopa and Ama formation. Okay, Srotorod will happen. Srotorod will create obstruction to movement of Vata. We know when a movement of natural movement of Vata is obstructed, it does not stay in one place. It will start moving in various directions. Vimarga Gaman, obstruction to Vata movement. Then Sthana Samshraya of Samavayu at Sandhi. So we know that doshas can be Sama or Nirama, with Ama or without Ama. In this case, it is with Ama. Hence, it is called as Samavayu. Okay, Samavata. It takes Sthana Samshraya at the Sandhi. Sandhi is the joint. Okay, so there will be Kapha Prakopa or Ama formation. If Kapha Prakopa happens first, then Ama formation will be the next step. In certain diseases, if Ama is already there and it uh, moves in the body and finds a favorable place, which is Sandhi or joint in this case, it will take Sthana Samshraya there. So, Kapha Prakopa and or Ama formation, so it will clog the pores, it will create Srotorod, it will obstruct the movement of natural movement of Vata, and that Samavata mixed with Ama, Vata mixed with Ama will take Sthana Samshraya at the Sandhi. Samavayu will take Sthana Samshraya at the Sandhi, which will create Sandhi Gata Vata Srotorodhajanya. Okay. Now here um, you may find that the Samprapti is quite near or similar to that of Amavata. Even if the similarity is seen, the difference between Sandhigata Vata Srotorodhajanya and Amavata is when there is Sanchari Vedana in Amavata, whereas there is no Sanchari Vedana in Sandhigata Vata Srotorodhajanya or uh, uh, Sandhi Vata with Samavayu. Okay, there is no Sanchari Vedana. It is the specific joint which pains and only that joint pains. Whereas in Amavata there is Sanchari Vedana. The movement, the pain will keep relocating from one place to the one joint to the other. Okay, so that is the difference between Sandhigata Vata Srotarojanya and Amavata. Okay. So Sandhigata Vata Purva Rupa. Crepitus means sound in the joint while walking. That is called as crepitus. Sound of the joint while walking. So that joint, that sound is due to one bone touching or the friction between two bones will create crepitus. Okay, so the knee joint, if there is dhatukshay and because of dhatu kshay or vata prakopa. The joint, there is uh, the rukshata has increased, and the synovial fluid in the joints, so for example in the knee joint, is completely finished, and the both the bones are coming close together, and while the movement is happening, this friction happens. So all the time when the patient is walking, it will create a sound of that tuck 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 sound while the patient is walking. That is called as crepitus, and that is due to friction between the two bones. Stiffness in the joint. Stiffness will be there because of the rukshata. It increases, vata aggravation is there, rukshata is there, and joint stiffness will happen because of the synovial fluid or the lubricant fluid. There is a lubricant fluid which is present in all the joints. Bigger joints, you can see the lubricant fluid. In the smaller joints, you may not be able to see it, but the lubrication is there around. In the bigger joints, it is present inside the joint itself. So there is a synovial membrane which will hold the lubricant fluid inside the joint. So that fluid will keep lubricating the joint while the movement is happening in younger age, or when the body is healthy. As the age progresses, or as the movement or utilization of that joint happens more and more, and if the body is not maintained properly with proper abhyanga, or so internal external oleation for example, the synovial fluid tend to reduce in quantity. If it is not properly replenished with internal external oleation, the synovial fluid will tend to decrease in quantity, and at a point it will decrease so much that both the bones will come together and or close to each other, and will create this crepitus sound. Okay, so uh, that is how what we relate to vata aggravation. And there is ruksha, tikta, katu, shita. So all those have a capacity or tendency to absorb the fluid part or the oily part in the body. So the synovial fluid also will be reduced because of this aggravation of vata. So these things happen simultaneously in the process of disease formation. Vata aggravation also happens simultaneously. The uh, joint, the utility of the joint also is more due to exercise or due to heavy usage. So there will be Khavaigunnya at the joint, and the aggravated vata will come and stay at the joint. So joint stiffness will happen due to reduced synovial fluid, and of course there is a tendency of the body. This is a natural tendency of the body that wherever there is pain in the body tends to create uh, a covering or a protective layer, not a physical protective layer, but a protection in order to reduce the movement of that part. So when there is pain, the tendency of movement is reduced, one, and second, because of the reduced tendency, uh, the muscles or the elements which are around that particular painful part will become stiff, so that the movement is less. Of course, it is interrelated. Movement is less, stiffness increases, stiffness is more, the movement reduces. So that all happens, it starts with the pain. Okay, and because of that pain, the movement is less, the stiffness will increase more, and because of the stiffness, the body's tendency also to move it will be less. Pain on exertion. Exertion means while walking or doing that activity of that particular joint, pain will be there. Now, why will there be pain? One is aggravated vata, and second is friction of the bones on each other. Swelling which subsides on rest. So swelling will be there because of course, vata aggravation, but it will subside on rest. We know that vata, when the body rests or that body part will rest, vata will pacify. Even if it is temporary pacification, it will pacify for a while. So swelling, which will be more while walking, will reduce when the body rests or that joint part is rested. Then the swelling will reduce. Symptoms of ama with joint pain. Symptoms of ama with joint pain. Okay. So the other symptoms of presence of ama in the body will be there with the joint pain also. So joint pain will be there as a part of Sandhigata Vata, but presence of ama, we know what are the signs and symptoms of presence of ama in the body. Question. Okay, question time. How do we know presence of ama in the body? Tell one by one. One person, don't say everything. Tell one by one.
White coating on the tongue.
Okay.
It doesn't float, they sink.
Okay.
Heaviness in the body.
Very good.
Shifting pain.
Not in ama. Not essentially every time ama will have shifting pain. Ama vata, if it is ama vata, then shifting pain will be there. But just presence of ama in the body, what you said, heaviness in the body, the stools don't float, they sink, there is coating on the tongue, reduced uh, food. So the intake of food is reduced. So you will see anorexia or the feeling of hunger will be reduced. So that those signs and symptoms will be seen along with joint pain in the Purvarupa stage of Sandhigatavata. Okay, so we saw generic Purvarupa, not Dhatukshayajanya and Surutarojanya separately. Those were together. Now, when we see Rupa, we'll see different. So, Sandhigata Vata and Dhatukshaya, Sandhigata Vata, Dhatukshayajanya, what are the signs and symptoms specifically seen? Pain in the joint, swelling in the joint. Okay, so crepitus during the movement. Touch of the joint is feel like air. So, if suppose this is the joint, okay, and you touch that joint which is affected with Sandhivata, Dhatukshayajanya, especially Dhatukshayajanya, Vata has found sthana samshraya here and has got accumulated here. When we touch, we feel as if the joint is filled with air. The swelling is there, but it feels like it is filled with air. Okay, so that is on sparsha pariksha that you can realize and feel when you do sparsha pariksha of the joint. Crepitus during the movement is there in Dhatukshayajanya. Restricted movement of the joint due to stiffness, one, and due to the pain, second, because there is friction. So the movement also is restricted. The patient will only walk if it is utmost necessary, else the patient will try not to walk. See, Sandhigata Vata is one of the most common diseases which you will find in your regular practice. One of the most common. Okay, age related Dhatukshay and Sandhigata Vata is certainly there. But even people with lesser age, younger age, but having Dhatukshaya Samprapti or Srotorodha Samprapti and doing physical activities. So recently, not very recently, however, I think 6-7 months ago, we had a patient who was a what is it called, bodybuilder. You understand bodybuilder who make who do bodybuilding. So he was a professional bodybuilder, so to say, because he didn't do anything else. He used to just exercise and used to represent his institution in various competitions. So he was a professional builder, we can say. So this guy used to eat protein and whatnot, meat, etc., eggs. So because they prescribe that you eat this, you protein, nourishment, etc., supplements, so many things they tell, because if you are a professional or you want to become a professional builder, you need to have that kind of support system, as we say. So he was advised to eat a lot of protein and meat and eggs. So he used to eat eggs like, I don't remember the count, but it was a heavy number. So he used to say that he would eat egg, raw egg, boiled egg every day without even realizing if he was hungry or not. Because he was told to eat, he used to eat. And ultimately, he developed indigestion, and with indigestion, ama formation. Then, because his activity was related to all joints and excessive activity, uh, I mean, that was one patient where I could see that his shoulder, his elbow, even his wrists, his ankle, his knee joints, all were affected with Amavata. All were affected with Amavata. Okay, now, so that was Amavata, but I'm saying even in younger age, people can get into it if they are not uh, conscious about what they are doing to their body. So even if somebody is telling you, be it a doctor or a dietitian, you have to understand the logic, the science behind it, and you should be able to relate it to your body. Forget practitioner, as a person also. Somebody suggesting you something, you should be able to relate. If you are not able to relate, ask questions. Who is advising you? If you have satisfactory answers, only then do it. So when you see benefit in doing something, only then do it. Your patients also are going to do the same thing. People who are conscious will ask you questions. Why should we do this? Why should we do that? What will happen? Etc. etc. So Sandhigata Vata, it all started from Sandhigata Vata being one of the most common things you will find or come across in your regular practice. And these patients, when they are Dhatukshay Janya, they are like your lifetime patients, because Dhatukshaya is in the later age is difficult to recover completely. It does not recover completely. Uh, it can be maintained with treatment. So those patients become your regular visitors who come after every few days, and they should have good patience to to undergo that treatment. And ultimately, of course, it is not the full course of treatment which they have to undergo. After a certain time, we can only put them on to maintenance, external uh, treatment, and some part of internal medicines like rejuvenation or asayana for the dhatukshay. Fair. So sandhigata vata, one of the most common things which you will find in your practice. Restricted movement of the joint, movement is always painful because of the friction in the bones. Usually starts with bigger joints. We already saw this. Sandhigata Vata Srotarojanya. Severe tenderness in the joint. Pain is tenderness means upon touching the patient will feel pain. So that is tenderness. Okay. A redness in the joint. There will be swelling and redness in the joint. Joint temperature is more as compared to the other body parts due to the presence of ama there. Jwara will be seen there because of, see, this is all because of the Srotorod, everything gets locked there. Okay, so hence you will find Jwara, Daha, increased temperature, etc. As the Srotorod goes away, we have seen that in the Ruksha Swedana, which we saw, the Potali Swed. We took that beach sand and we heated that and put it in a potali, and then we did the Ruksha Sweda, dry fermentation. As that fermentation is done, the Srotorod, it helps to digest armor and remove the clogs in the channels. Eventually what happens is because of the Srotorod is reduced or the armor is digested, the temperature in the joint reduces and comes back to normal as the other body parts. Why does that happen? Because the armor is digested and the clogged srotas, the srotarod is gone, and the exchange of heat becomes normal. Hence, the temperature of the that part of the body reduces. Reduces means comes to normal as compared to the other body parts. Swelling in the joints certainly will be there. Restricted movement of the joint will be there. Movement is always painful, common factor. So, what is the difference between Srotarojanya and Dhatukshayajanya in terms of the signs and symptoms? The temperature of the joint is normal in Dhatukshayajanya. Normal means same as the other body parts. In Srotorod, the temperature is higher. The touch to that joint will feel more warm as compared to the other. Jwara will be at times seen in Srotorojanya, Dhatukshayajanya Jwara will not be seen. Swelling in the joints, uh, in Dhatukshayajanya, it will feel as if it is filled with air. In Srotorojanya, the joint will be swollen, but it won't feel like air. Something solid is there inside. That will be the feeling uh, in Srotorojanya because of the presence of ama there. You will find that the swelling is there, but it is not uh, like hollow swelling. Okay, it is solid swelling. Okay, that something is there inside, not hollow. Restricted movement, etc., is there. Severe tenderness in the joint will be there in Srotorojanya. Dhatukshayajanya, it will be painful movement only. Okay. Prognosis, early stage, early stage joint disorders are easy to treat. So, early stage means two things are there. One is younger age, early stage of life, and second is early stage of the disease. So, if early stage of life and early stage of the disease are got together, then it is fairly easy to treat because the body has that capacity to recover, recoup. In the later stage, Jara Avastha, already there is a increase or aggravated Vata dosha in the later part of the life. That time when you have the early stage, it will reduce the problem, but it may not be able to cure it completely. It will be maintained with the medicine. So the second sentence is, when degeneration is more, then it can be maintained with medicine. Okay, yapya. So degeneration will be naturally more when the age is beyond a particular, say 45 or 50 years of age. The degeneration, the pace of degeneration will be faster, right? Again, depending on, there is a conditions applied to it, how you have maintained the body properly or improperly. So if the body is maintained nicely with regular exercise, with nourishment, with proper food, and if the other systems are in check, then first thing is they may not have that sandhivata, sandhigata vata. But if at all there is due to the trauma or some accident, then they may heal faster as compared to the other people. But if the body is not maintained properly, degeneration is happening, and vata prakopa happens simultaneously with ahara vihara, then sandhigata vata in severe degeneration will be there. So because of that degeneration, the pain, the stiffness, the intensity will be more, and the uh, the reversal of that particular disease will become near to difficult. I mean, near to impossible, I should say, because the regeneration of the cartilage with normal medicine, with regular medicines, is not possible unless it is treated with something which is magical medicine, which I don't want to comment on. So when degeneration is more, then it can be maintained with medicine. They will have a good lifestyle. I mean, a good life without without problems. So the day-to-day activities can be managed easily. To that level, to that extent, we can bring the patient, and then we can tell the patient to uh, apply oil and give some rasayana or nourishing medicine, so that their asti dhatu is nourished properly. Okay. If Srotorod is cleared, then the curing can happen over a long term treatment. Long time. It will take more time. So it means that when there is Srotorod Janya Sandhigata Vata in the later stage, then once the Srotorod is cleared, then the treatment will happen as per the normal treatment of Sandhigata Vata. So the difference in treatment we'll see in the next slide is digestion of ama. Once the Srotorod is cleared, then we have to treat the patient like the normal Sandhigata Vata or Dhatukshayajanya Sandhigata Vata. Okay, of course, according to the signs and symptoms, the treatment will be aligned. But early stage, in early, so newly formed Sandhigata Vata in early stage, in young age, is fairly easy to treat. Degeneration is more, it will be maintained with medicine. In later part of the life, or in senior patients, Srotoros once is cleared, then the curing can happen over a long term. But here, if the degeneration is more, then it has to be maintained. It will be maintained with medicines only. Okay. Chikitsa, Dhatukshay Janya. So there is slight variation. We'll see what it is. Dhatukshay Janya, Sandhigata Vata, what is the line of treatment? Snehana. Now here it is pretty simple, because there is Kshaya, there is Vata aggravation, there is depletion of Dhatus. Just keep giving nourishment. So what should be the regimen? Snehana with Narayan oil, Bala oil, Vishagarbha tel. Now Vishagarbha tel is quite hot potency oil, and when there is pain, intense pain, then in that case Vishagarbha oil can be used. Otherwise, Narayan oil, Bala oil are quite sufficient and good to lubricate the joint. Okay, Vishagarbha can be used only when there is pain, intense pain. Swedana, Nadi Swedana. We know what is Nadi Swedana. So in that, if we are able to do Dashamula decoction and do Nadi Swedana, it will give better results. We know that Dashamula is a very good pacifier of Vata dosha. And if also again, if you do not have Dashamula, for example, you can still do Nadi Swedana because you have done Snehana. What we need is Swedana. If you are able to do it with Dashamula decoction, nothing like it. If not, at least do Nadi Swedana. Lepa, Dashanga Churna. So Dashanga Lepa acts very good in Dhatukshaya Janya, Sandhigata Vata. So Dashanga basically is 10 types of herbs are put together that is different than Dashamula. So that Dashanga Churna is a specific combination which is good for alleviating pain in Dhatukshayajanya Amavata. Anulomana for Vatanulomana, castor oil, Gandharva Ritaki will be good. So here Vatanuloman, because there is no Srotorod, so just Vatanuloman will help to break the Samprapti. To break the Samprapti in Sandhigata Vata, Gandharva Ritaki, castor oil. So aggravated Vata dosha when is going out of the body. So it will also keep reducing from the dosha dusha samurchana. That will break and it will start coming back to normal. The next challenge is the degeneration, which, as I said, will be maintained with medicine. Raktamokshana, so bloodletting. So if there is suppose knee joint, the osteoarthritis, the knee joint is affected, then you can do Raktamokshana above or below or the sira or the veins behind the joint. So around the joints, you can remove up to 50 ml of blood, which helps in the in decreasing the pain in the uh, in the joints. Joint pain basically reduces after Rakta Mokshana, and it is quite quick. So a quick action will happen. So it can be done with syringe, also needle syringe, or it can be done with uh, Jalauka, okay, leech. Dahana karma. So Dahana basically is done with Suvarna Shalaka Dahan. So Dahan is in okay. So Suvarna Shalaka, suppose, is a stick made of gold. Okay, made of gold, and one side of that is heated, and the other part of the shalaka or the stick is touched to the painful part of the joint, and that is called as dahana karma. So that is agni karma basically, which gives it releases the vayu or the vata in those specific points, and it will help to reduce the pain. So dahana karma, rakta mokshana basically is for reducing the pain. Okay, and the vata which is accumulated in the joint, it will help to release that. Okay. Shamana. In Shamana Chikitsa pacifying treatment, Yogaraj Gugul Mahayograj Gugul. These two are tablets. So both are very good. They are Google preparations, and Google is supposed to be very good nourisher to the joints, to the Asti Dhatu. Okay, Yograj Google and Mahayograj. Ashwagandharishta is good for nourishment of all the dhatus we know. Shatavari Kalpa is good nourishing medicine. Bruhatvat Chintamani, gold preparation again, which will nourish the dhatus, as well as it will alleviate Vata dosha pretty quickly. Bruhatvat Chintamani Ras and Samir Pannagras. Samir Pannagras is common in both Srotorojanya and Dhatukshayjanya, both. So it is a very good Vata alleviating medicine. And even if there is presence of ama, it will digest that ama as well. Okay, so Samir Pannagras is uh, is a good drug of choice in treating both Srotorod and Dhatukshayjanya Sandhigata Vata. So what is the line of treatment for Srotorodjanya Sandhigat Vata? Snehana, not done. We know when there is presence of ama, Snehana is not done. If at all it is to be done, then Vishagarbha oil. If the pain is intense, then in that case Vishagarbha oil can be used. Vishagarbha oil is a potent oil which has herbs which are Tikshna Ushna. So when they are Tikshna Ushna, they will not only alleviate the pain but also will help in digesting the ama. So that is the oil which which can be prescribed in Srotorojanya Sandhigata Vata for Snehana. Best is not to apply any oil. Swedana, Nadi Swedana can be done. You can, if the temperature uh, of the joint is more than Ruksha Swedana, you can start with Ruksha Swedana. You see how the temperature is. As the temperature decreases and it comes to normal, then you can shift the patient to Nadi Swedana. Okay, initially you can do, depending on the temperature of the joint, you can decide whether to do Ruksha Sweda or Nadi Sweda. So when the temperature is more, that time start with the Valuka Pottali Sweda and then shift to Nadi Svedana later part once the temperature is reduced. Lepa Dashanga Churna. Now here the lepa can be pradeha. It can be hot lepa. Okay, ideally should be hot lepa so that it will help in digesting the ama also. Even in Dhatukshayjanya, you can apply hot lepa, no problem, because we have to elevate vata there. So it's not that in Dhatukshayjanya you do pralepa and in Srotorojanya you do pradeha. No, both the places you can do pradeha. Okay, pradeha is hot lepa. We all know.
Hello?
Mhm.
Why would we do hot lepa if there is redness and it's the temperature is more on that area?
Good question. You have to answer. I already explained that the temperature is blocked there. Okay, there is a covering of armor there. Hence, the heat is blocked there. Okay, hence there is increase in temperature. As the Srotorod goes away, the temperature will reduce. So Srotorod is the culprit factor here. So once the ama is digested, the temperature also comes back to normal. Okay, so similar happens in Amavata also. When you do Ruksha Sweda, that time as the Srotorod is removed or the Ama is digested, the temperature starts coming down even after we do Swedana. Correct. So Swedana is done, Ruksha Swedana is done basically to digest the Ama. Even in Pradeha, heat will help in digesting the Ama. So the heat is basically used to digest the Ama. Dry heat will be used to digest the Ama, and once it is digested, the temperature will come back to normal. And you will yourself see that the redness, the temperature, the swelling reduces. Okay?
Yeah.
Got it?
Yeah.
Okay. Snehana not Nadi Svedana Dashanga Anulomana. Anulomana here with castor oil, Gandharva Haritaki will be good. Rakta Mokshana even here is good. Dahana with Suvarna Shalaka Dahan is good. Shamana Chikitsa. Here the difference is Maharasnadi Kwat. Maharasnadi is given when there is presence of Ama. Triphala Gugul is given when there is presence of Ama. Amruta Gugul is given when there is presence of Ama. So all these medicines which are mentioned here are given when there is presence of Ama, and we have to digest Ama as well as pacify Vata dosha. So Maharasnadi Kwat decoction, ready preparation is available. I think it is available there as well in the center. Then Triphala Gugul is good for digestion of Ama as well as Vata pacification. Then Amruta Gugul, Guduchi, Kaishwar Gugul is good. Rasna Gugul, Samir Pannag. These are ready preparations, Gugul preparations, which are good to digest Ama as well as alleviate Vata. Samir Pannag is one of the best uh, drug choices for Sandhigata Vata, be it Srotorojanya or Dhatukshajanya. Of course, Samir Pannag should be used very mindfully in smaller quantities. It is quite strong as a medicine, so should be used in smaller quantities mixed with something. Okay, so then we have uh, a pattern here where we mix herbs which go well uh, in that particular disease, and if we have to add bhasmas, if we have to add stronger medicines in smaller quantities, we mix them in that churna yoga, in that mixture, and then we mix them well so that it is evenly mixed, and the patient consumes sorry, even 1 spoon of that medicine, he will have effect of all the ingredients of which are mixed in that particular mixture. So smaller doses of because students do ask me if we have to add or if we have to give Suvarna Bhasma or Raupya Bhasma or Pravala Bhasma or Shankh Bhasma separately. I mean, it is not into a preparation. It is, we have separate Bhasma. How do we give it? So I tell them that make a preparation mixture of the herbs which are available, which go well in that treatment. Add the bhasmas in the smaller or desired quantities in that. Mix them well. Take your time. Mix them well because bhasma, the particle size is fine, smaller size. So if you mix them well, it gets evenly mixed in all the entire mixture. And when the patient consumes your prescribed quantity of medicine, be it 1 spoon, 2 spoon, 3 spoons, or whatever, then, or even if you make smaller packets of single dose, every particular dose will have part of all the ingredients in it. Okay, so make sure when you add any kind of bhasma, any kind of fine powder like Samir Pannagras, Mix the mixture properly and take your time. Don't be in a hurry, because bhasmas, one, they are expensive. Two, when they are evenly mixed, then their absorption digestion becomes easier. And when evenly mixed, every time the same proportion of the medicine of all the ingredients will go uh, every time. So the same proportion. So if you have 10 ingredients and say 100 milligram of all the ingredients have to come in that 1 gram of medicine every dose, then every time the same proportion will go if it is mixed well. So when you, at a later stage, when you hire people for making or preparing the medicines, that time you have to teach them well how to prepare the medicines. You have to make sure you keep checking how they do it, because it's your patient. You want the results to come. You are responsible, you are answerable, you are charging the patient is looking at you, not your assistant. So even if you are hiring an assistant who is going to uh, dispense the medicine, make the medicines, write the instructions, perform the treatment like Abhyanga or Shirodha or whatever, you have to make sure that you watch everything initially and intermittently, so that they know that you are checking everything properly. Because it is a human tendency, they may not do it deliberately, but it is a human tendency to take things lightly when nothing serious is happening around. So people tend to become casual, and in that casual you are in a way playing with the life of the patient. I'm using the word playing with because they are handing over their life to you. Whatever you say, they are going to follow. Whatever you say, they are going to eat. Whatever you say, they are going to take as medicine. So ultimately, whatever you say, they are going to follow, which means that they are surrendering to you completely. And when that is happening, the entire responsibility and onus comes to you, onto you, to make sure that you deliver what you feel is the best treatment to them. And in order to do that, uh, all the things which are uh, aiding or helping in the treatment should be uh, up to the mark. Bishak Dravya Upasthata Rogi Pada Chatushtayam. You know this, I'm sure you know this verse. Bishak Dravya Upasthata Rogi Pada Chatushtayam. So whatever verses I am saying, most of them come from the classical reference textbook called Sartha Vagbhat or Ashtanga Rudhay. Vagbhat is a very easy textbook to read and refer, because he read Charaka, he read and referred Sushruta and whatever best. He was a physician also. So whatever he could understand from both of them, he compiled that into Ashtanga Rudhay or Sartha Vagbhat. So that we also refer during our uh, student life. We are still students. I may not be able to show you, but the Vagbhat is always there in my near my table, always, because that is one book which we have referred to on and on and on. So the same book which I purchased in 2001, the same book I am using. So the verses in that are easy to recite, easy to recite. Hence, in our first, second, third year, we recited most of the verses, shlokas from Vagbhat. So Bishak Dravan Upasthata Rogi Pada Chatushtayam, this also comes from Vagbhat. So what does that mean? Bishak is the doctor, Dravya is the medicine, Upasthata is your assistant, and the Rogi is the patient. All these are four bases of chikitsa. Four bases of chikitsa. Four pillars of the chikitsa. Bishop, doctor, medicine, assistant or helper, and the uh, the patient are the four pillars of chikitsa. Even if one pillar is removed, the entire chikitsa can come down. So easy to relate, correct? So easy. The doctor is there, the helper is there, the medicine is there, the patient is there. Even one of them backs out, the entire the treatment can come down. So backs out means in absence of the helper, treatment cannot happen. Not like that. But if that particular entity is unable to deliver what is expected, then the entire treatment can come down. The results will come down, right? So all I am trying to say is, where it started with small doses of basma, etc. Mix it well, make sure that your helper is there to, you are always checking what the helper is doing, and they are doing uh, exactly what you want them to do, and not what they have learned somewhere else, or what they have heard, or what they have seen on YouTube, etc. I have said this multiple times. Even while you are students, you may find a lot of literature online. With AI, etc., has come up. It is crazy. Everything can be learned online. Everything can be learned online is what is the understanding, okay, which is false understanding. Everything can be learned online. Medicine cannot be learned online. Okay, so you have to learn it by various means. You have a guru, you have your books, you have your practical practice, the treatment practice, and the actual experience which you take. So medicine cannot be learned online, and more so when there is a lot of information available. uh, the source of information, even if it is reliable, the source, but the person who has uploaded that or created that may not be uh, the master of it, may not be the master of it. So uh, I won't say wrong, but not up to the mark information be available online. So you can check, you can refer to things, but whatever you have understood as primary, keep that as your understanding and knowledge. If you have queries, you ask once, twice, 10 times. I am there, Dr. Manish is there, you have your Hillary is there, Sonia is there, you have people around. And if we are not able to give you an answer immediately, we'll definitely refer to our textbooks, our source of knowledge, and get back to you with the best possible solutions or answers to your queries. Again, coming back to Samir Pannat, because I keep going away from the topic. However, this is again important for you to know, because we are talking today because you are in the learning phase. Once you have passed out, we may not be able to connect so frequently as we are doing today. Okay, then it is only okay, it is now a ready ball, it is now set to roll, and it will keep rolling. There is no turning back. Okay, so um, you keep this information with you, within you, for your future reference. Okay, Sandhigata Vata Pathya, Dhatukshayajanya. What is the Pathya? Garlic, soup of horse gram, Kulatha, Yusha. Then Snigdha and nourishing Ahar, Madhura, Amla, Lavana Rasa Ahar, which is all nourishing. Old rice, wheat, milk, ghee, meat soup, all these are nourishing, because the samprapti is simple. Dhatuksha is there, nourish them. And meat soup. So meat soup of the desert animals will be uh, yeah of the desert animals, even the aquatic animals is good, no problem. Again, we have to relate to the agni of the patient. Agni, if the patient is has good agni, only then he will be able to digest all these things properly. So start with small quantities and then take it to the next level. Pathya in Srotarod, Deepan, Pachan, Ushna. Very obvious because of the presence of ama. Garlic you can see in both places. Garlic is a rasayana. Garlic is a rasayana to all the tissues, okay, and it has good properties of nourishment as well as digestion. Soup of horse gram, common both places. It is ushna and nourishing both. Ruksha ahar, initially until the srotorod is digested. Katutikta rasa, until the srotorod is digested. Ruksha svedana, until the srotorod is digested. Hingu, ginger, until the srotorod is digested. Once the srotorod is digested and you see that there is some amount of degeneration, then you can follow the regimen of Dhatukshay Janya Sandhigata Vata also. Okay. Apathya in Dhatukshay, Ruksha Ahar, Katu, Tikta Rasa, Ruksha Swedan, heavy exercise. All this is Apathya because all this is going to aggravate Vata and can aggravate the Dhatukshay. Okay, so Rukshahar, Katu, Tiktarasa, Ruksha Swedan. Heavy exercise should be avoided in Dhatukshay. Apathya, Snigdha, Apathya in Srotorod, Snigdha, nourishing, Madhur Amla Lavana Rasa should be avoided because it is going to increase the ama. Heavy exercise is going to increase the pain and it can complicate the Dosha Sammurchana. Okay, Dosha Sammurchana will be more complex with heavy exercise in terms of in this condition of Srotarodjanya Sandhigata Vata. So with heavy exercise, the dosh will become more lean. Lean means it will go deeper into the channel and then it will become more difficult for us to uh, to digest the ama and remove the Srotarod. Okay, so rest in both the cases is equally important. Is equally important. With exercise, the ama will be digested. No, sorry, that will not happen. Okay, heavy exercise, the or even exercise, the ama will become more lean. It will enter more into lean is a Sanskrit term, which means it is going deeper into the channel. Okay, it goes deeper into the channel, makes it more difficult for us to treat that condition. Okay. Any questions are welcome. Else we are done with Sandhigata Vata. No? Okay, fair. So with this we complete Sandhigata Vata. Thank you so much.